Hey everyone, and welcome back to the MediByte channel. I am so incredibly glad you're here with us today. As a healthcare professional, I completely understand that discussing intimacy, especially during and after pregnancy, can feel, well, really vulnerable. It's one of those topics that gets whispered about or, honestly, just ignored completely. But I want to set a really reassuring and safe tone for us right out of the gate today. What you might be experiencing right now is incredibly common, and more importantly, it is deeply understood by medical professionals. So, in today's explainer, we're going to explore sexual dysfunction during pregnancy and the postpartum period. We'll look directly at the clinical information to break down the science, the symptoms, and most importantly, the solutions. We're going to make this whole complex topic clear and manageable for you.
So, here's our roadmap for today's explainer. We'll cover 5 key areas. Number 1, normal female sexual function. 2, pregnancy and postpartum risks. 3, physical and emotional factors. 4, diagnosing sexual dysfunction. And finally, number 5, effective treatments and therapies.
All right, let's jump right into Section 1, normal female sexual function and understanding that mind-body connection.
Okay, before we can even begin to fully understand how pregnancy and childbirth change our bodies, we first need to establish what healthy sexual function actually looks like. The female sexual response cycle is this intricate, perfectly normal biological and emotional journey, and it's basically broken down into 4 distinct phases. Step 1 is desire, or your libido. This is simply the wish to engage in sexual activity, and it can be triggered by thoughts, words, sights, or touch. Step 2 is arousal. This has a very physical element to it. Specifically, you get an increase in blood flow to the genital area, which causes swelling or engorgement and increased vaginal secretions for lubrication. Then, step 3 is orgasm, which is the peak of sexual excitement, where these rhythmic muscle contractions occur around the vagina. And finally, step 4 is resolution. This is that widespread sense of muscular relaxation and overall well-being. Going through this cycle really helps us establish what normal looks like before we dive into how the absolutely monumental event of pregnancy disrupts it.
And here's the thing you have to remember. The mind and body are deeply, intimately connected. You literally cannot separate the physical from the psychological here. For women, desire and arousal are so closely linked. Psychological stressors, whether that's anxiety, relationship worries, or just general emotional stress, they can easily trigger physical changes that completely interrupt the cycle we just talked about. If your mind is stressed, your body's physical response, like that increased blood flow for arousal, well, it can be directly suppressed.
Moving right along to Section 2, pregnancy and postpartum risks, the disruptions to the journey.
We have to talk about how certain childbirth traumas significantly increase the risk of postpartum sexual dysfunction. We're looking at things like cesarean delivery, deliveries assisted by forceps or vacuum extractor, episiotomies, or perineal tears, which, if you're not familiar, are tears in the area between the opening of the vagina and the anus. And I just really want to validate your experience for a second here. These are very real physical traumas. It is entirely natural that recovering from these events is going to cause pain near the vagina's opening. It's going to decrease sexual interest, and it's going to directly impair your ability to be physically aroused. I mean, your body has just been through a major event. Healing takes time. Furthermore, we have to look at the actual biological reality of postpartum life. Specifically, we need to look at the hormonal connection between breastfeeding and vaginal health. See, when a mother is breastfeeding, her estrogen levels naturally drop. And because these estrogen levels are low, the tissues of the vagina can become really thin and dry. This physical lack of lubrication makes sexual intercourse extremely uncomfortable and sometimes incredibly painful. Listen to me, it is not a lack of love. It is not a personal failing. It is a direct biological result of dropping hormones during the breastfeeding phase.
That brings us to Section 3, physical and emotional factors, where we uncover the root causes.
It is absolutely crucial to realize just how interconnected the physical and psychological hurdles truly are. It's like a giant puzzle. On one side, we see psychological and social stresses, things like severe sleep disruption, massive changes in family roles, postpartum depression, body image issues, or even a history of trauma. Then, on the flip side, we have physical and medical factors, those dropping hormones we just mentioned, potential infections, pelvic organ prolapse, which is where a pelvic organ actually drops down, and even the use of SSRI antidepressants. What's vital to take away from this is how these two sides interact. Actually, it's more like a feedback loop. For instance, untreated postpartum depression can severely dampen your libido, but if you treat that depression with certain SSRI antidepressants, those medications themselves commonly cause sexual side effects. It's a complex web, and it deeply, deeply affects intimacy. Now, you might hear doctors use a clinical term like genitopelvic pain/penetration disorder. This is the involuntary tightening of the muscles around the vagina or experiencing pain during sexual activity. I really want to clearly define this term to normalize it for you. This is a recognized, heavily documented medical condition that can develop postpartum. It is not something you are making up in your head, and it is certainly not your fault.
Another medical term you should probably know is vulvovaginal atrophy. I know it sounds intense, but it simply refers to the thinning, drying, and loss of elasticity in vaginal tissues, which is very often due to those decreased estrogen levels we talked about earlier. This condition makes intercourse physically painful. Understanding this definition is so important because it validates exactly why so many postpartum women experience severe physical discomfort. Your tissues literally change because they are starved of estrogen.
All right, Section 4, Diagnosing Sexual Dysfunction. Let's find some clarity.
So you might be wondering, how do doctors actually diagnose postpartum sexual distress? It can feel incredibly intimidating to bring this up with your physician, but knowing exactly what to expect from the diagnostic process can really give you the confidence to start that conversation.
Well, here is exactly what that process looks like. First, for a formal clinical diagnosis of a dysfunction disorder, these symptoms typically must cause significant distress for at least 6 months. Your doctor is going to conduct a detailed interview. They'll ask about your symptoms in your own words, your mood, and your relationship history. They'll also review any past obstetric procedures, pelvic injuries, or past trauma. Then, they'll perform a pelvic examination to identify the exact source of the pain and check for underlying vaginal infections. You see, doctors look at the whole picture, from your relationships to your physical healing. Because, as we've learned today, the whole shebang is connected.
But here is the absolutely crucial takeaway. You are in control. For women with a history of sexual trauma or those experiencing severe postpartum pain, just the thought of a pelvic exam can be incredibly difficult. But there are medical strategies to make this entirely tolerable and safe. You can discuss the exam with your doctor before it even begins to agree on communication. You can hold a mirror to see exactly what the doctor sees. Or you can even place your hand on the doctor's hand to have a much greater sense of control. You dictate the pace.
And finally, Section 5. Effective treatments and therapies, a hopeful path forward.
Let's dive into the actual medical and physical interventions available because there are so many good ones. If low estrogen is the root issue, vaginal estrogen therapy using creams, tablets, or rings can directly treat the dryness and thinning of those tissues. Using silicone or water-based lubricants can immediately ease discomfort during intimacy. And if you're dealing with tight muscles or pain, pelvic physical therapy is honestly a game changer. Physical therapists use amazing techniques like myofascial release or electrical stimulation to stretch and relax those tight pelvic muscles. If your antidepressants are causing issues, a doctor can help adjust your SSRI medications. And finally, self-dilation devices can be used in the privacy of your own home to gently stretch tight pelvic muscles and make the vagina less sensitive over time. These treatments directly, physically combat the symptoms we outlined earlier.
But remember, treating the mind is just as vital as treating the body. Psychological and behavioral support is absolutely key. Cognitive behavioral therapy, or CBT, can help you reframe a negative self-view or body image issues postpartum. Mindfulness-based cognitive therapy is fantastic for helping you stay in the moment during intimacy, basically freeing you from all those distracting worries. Couples therapy can help resolve conflicts and rebuild that communication and trust, while specialized sex therapy can help both you and your partner navigate this brand new phase of your sexual life together.
I love this quote from the clinical literature. It's highly recommended by medical professionals to just completely rethink intimacy during this time. Doctors may suggest types of sexual activity other than vaginal intercourse, such as masturbation, massage, mutual caressing, and cuddling. I think this brilliantly illustrates that intimacy is a broad, beautiful spectrum. If penetration is painful right now, no problem. Non-penetrative closeness is a perfectly sound, medically recommended strategy to maintain connection and pleasure while your body continues to do the hard work of healing.
Your maternal sexual health absolutely matters. You do not have to just live with pain or distress. There is a whole world of medical and psychological support waiting out there for you. So I'll leave you with this question. Are you ready to prioritize your own healing and take back your comfort and joy? Thank you so much for joining me on this explainer today. Please like, share, and subscribe to the MediByte channel for more compassionate, evidence-based health support. Take care of yourselves, and we'll see you next time.